So now let's move on to our presentation. We have two topics for today. After each topic, we will pause to take questions and then we will move on. So please welcome Autumn Boylan, Deputy Director, Office of Strategic Partnerships at the Department of Healthcare Services, who will go over Children and Youth Behavioral Health Initiative update, as well as the Justice Involved Reentry Initiative. So Autumn, while we get things started, please feel free to introduce yourselves before we begin.
Thank you so much, Isabel, for the introduction. I am very happy to be here with you all this morning to share out these very exciting programs that I am very privileged here at DHCS to be able to oversee. I'm going to begin by talking about the Children and Youth Behavioral Health Initiative. And some of the work streams that DHCS is leading to help make behavioral health, meaning mental health and substance use disorder services to children, youth, and families more accessible in schools, in communities, and in healthcare settings as well. So today I'm going to talk a little bit about some of the strategies that we have implemented as part of the CYBHI to make services more readily available, whether that's in school or in the digital space. And I'm happy to share those exciting resources so that as you talk with folks in the community about resources that are available to them, you'll be able to take this information with you and share out all of the great work that we've done as part of the CYBHI. The Children and Youth Behavioral Health Initiative is a $4 billion investment by the administration to reimagine the services and supports delivery system for children, youth, and families. And there are many different things that we are doing under the umbrella of the Children and Youth Behavioral Health Initiative. But one of those things is expanding school-based mental health and substance use disorder services while holding our health plans accountable for coverage of services that they are required to provide to their members. So this is a program that provides reimbursement to our school districts called local education agencies and our colleges and universities, and requires the health plans to pay for those services in schools. And this includes all health plans. So many of the health insurers that some of us are enrolled in, like Kaiser or Anthem or Blue Shield, are all part of this program to provide resources to schools who play such a critical role in providing that frontline support to children, youth, and families. Many children, and especially school-age children, do not go to the doctor or do not necessarily go to see a mental health specialist in the community. Kids are seen by their doctor typically most frequently in the first 5 years of their life when new parents are taking their children for well child visits. But data show that visits to a primary care provider or pediatrician really drop off for school-age children. And so schools are really the place where many children and youth, particularly children from underserved communities or rural communities throughout the state of California, are getting access to both physical health and mental health services. And so what we're trying to do with this program, which we call the CYBHI fee schedule program, is to make sure that when kids need help with an emerging or existing mental health condition or with issues related to substance use disorders, that they can get the help that they need at school, and that schools can work closely with health providers to be able to get kids linked up with community-based care options when that's most appropriate. So that is the idea behind this program. On the next slide, we'll go into a little bit more detail about how the program works, but this applies to all public schools in California that provide K through 12 educational services. So our local educational agencies, which are school districts throughout the state. And in California, we have about 1,100 school districts in the state, in all 58 counties, with over 10,000 school sites that are part of this network of school districts providing educational services to students in California. This also applies to our public institutions of higher education. So our California community colleges, California State University, and University of California campuses, so that students, while they are in college, are able to also access critical mental health and substance use disorder services through their school, and have those services be paid for by their health plan. So the idea is that schools and their community providers, partners, who are already delivering care to students, will work collaboratively with our health plans, who will ultimately fund these services that are being provided in school settings. Next. And this applies not just for the Medi-Cal program. So I know that you're all Medi-Cal coverage ambassadors, and the Medi-Cal program provides coverage to about half of the children in the state, in terms of their health insurance options. But what's unique about the Children and Youth Behavioral Health Initiative is that it's really for all children, not just kids that are enrolled in the Medi-Cal program. So we wanted to make sure that we're also holding our commercial health plans accountable, as well as disability insurers who are already obligated under both state and federal law to provide mental health and substance use disorder services in parity with the way that they provide physical health care services. So what that means is that if you have the need to go to your doctor for an earache, or you're not feeling very well, or you have some symptoms of a potential physical health related condition, there's no limitations in terms of the number of appointments that you can make with your doctor. And parity requires that health plans also provide mental health and substance use disorder services without those types of limitations that would say maybe you can only have a few visits for a mental health condition. So that's not allowed under federal law. And all of these health plans, as part of the essential health benefits under the Affordable Care Act, are required to provide mental health and substance use disorder services to their members of their health plan. And so since the health plans are already required to cover these services, we want to make sure that that coverage extends to the services that schools are providing to students on a daily basis. Next. As you can imagine, this is very complicated for school districts to figure out how to navigate all of the different health plans in California. And we have about 42 different health plans that are obligated to provide this coverage in school-based services. So instead of having each individual school district try to work with all 42 plans, the state decided to administer the program through a statewide third-party administrator, who can help manage and oversee the provider network, and manage all of the payment of claims by the health plans to the school districts. And the reason that this is important is because part of the messaging that we're trying to get out to parents, caregivers, families, is that we need to collect certain information from the schools need to collect certain information from parents and caregivers about the type of insurance that a student is enrolled in. So whether they have Kaiser or whether they see a private doctor through the Medi-Cal fee-for-service delivery system, or whether they're enrolled in another type of health insurance. And again, there's 42 different types of health plans that are obligated under this program. The schools will need to ask for information about the student's health insurance in order to submit a claim to the third-party administrator and get reimbursement from the particular plan that is responsible for covering those services. And so we are developing a statewide communication campaign to help educate parents and caregivers about this program and explain why our schools are now going to be asking for the students' health insurance information. And really, it's so that we can provide resources to schools to fund services that they're already providing to students. And this is a way for us to be able to sustain over the long term the types of services that schools offer so that kids can get their needs met, families can get their needs met in that school setting. Next. So we talked a little bit about the types of plans that are obligated under the state law to provide this reimbursement. There are some exceptions, and not all types of health insurance coverage are a part of the program. For example, if there's a student that's enrolled in a federal plan, like in an Employee Retirement Income Security Act, or receives their healthcare coverage through the Veterans Affairs Administration or through the U.S. military, those plans, because they're regulated by the federal agencies, are not obligated to provide reimbursement to California schools. There's also certain types of self-insured plans or self-funded plans where the employer acts as the insurer on behalf of their employees, for example, and those types of plans are also excluded. So while this is a multi-payer program that covers about 80% of students in the state of California, it does not cover services for all students in the state. And so that's another reason why the third-party administrator will work directly with school districts to determine what type of health insurance the student may have. And so this information is going to be super important for parents and caregivers to understand so that they can help participate and get resources for their school. Next. Under this program, we offer a variety of services that can be reimbursed. So there's psychoeducation services, which are meant to help educate people about mental health and substance use disorder conditions. That also includes skill development. So for example, if a young person in elementary school needs some support to help regulate their emotions when they're feeling their big feelings, and they need strategies for how they can kind of bring down their emotions from those big feelings to more manageable feelings, psychoeducation services can help offer some support to students in learning the types of coping strategies that are helpful, like mindfulness and breathing techniques and other strategies for regulating your emotions. This is something that actually we all could benefit from in kind of learning how to regulate our emotions when we feel those extremes in our emotions. The services also include screening and assessment services. So if kids are struggling, but maybe we don't know what's going on with them, the schools can conduct screening and really try to help identify mental health needs for students in the K through 12 setting, as well as in colleges and universities. This also includes screening for adverse childhood events, which can be caused by incidents of trauma, such as the recent wildfires in Los Angeles County, or other types of trauma, including violence in the home, community violence, poverty. There's a whole list of things that contribute to adverse childhood events, and it's important to screen for those adverse childhood events so that interventions can be applied early, and people can have the opportunity to receive treatment services to help, again, identify those strategies that will help them work through those adverse childhood events. And so the screening also includes screening for ACEs, or adverse childhood events. It also includes treatment services. So kids can get access to counseling and psychotherapy services in school from a licensed practitioner or from a school psychologist or a school counselor, for example. And those services would be reimbursed by the health plans. And then it also includes coordination of care. So coordinating with the primary care provider or the health plan, or with other social supports in the community, like housing supports or food bank services, for example. All of that would be covered under this program. Next. And there's lots of different practitioner types that are eligible for reimbursement under this program, including, like I said, school counselors, school psychologists, and school social workers, as well as the registered nurses that are working in schools to provide services to students. And then pending approval from the federal government of an amendment to our Medicaid state plan, we also will have the new certified wellness coaches, which is the new program launched as part of the Children and Youth Behavioral Health Initiative by the Department of Healthcare Access and Information, which offers a wellness coach certification for individuals who have a certain type of associate's or bachelor's degree, or who've been working in the mental health or substance use disorder field for some time and can qualify under the requirements as a certified wellness coach. So this provides a new pathway for reimbursement of services provided by people with experience who may not have a credential for school-based services or be licensed. And so if you're interested in learning more about certified wellness coaches, we'll drop some information in the chat and you can find out about how you could become a certified wellness coach if that's something that you're interested in. Next page. So some of the things that we want parents and caretakers to know about this program is, first and foremost, there are no out-of-pocket costs for families when students are receiving services through school. Even if the parents typically have a copayment or deductible, they will not be charged any fees by the health plan or by the school for any of these services. And the health plans are not allowed to send a bill to the parents or caregivers at any point. So the statute and state law requires the health plans to cover these services without any cost sharing mechanisms, which means that there are no out-of-pocket expenses for families. These services are completely free and offered to all students across the state of California through their school. We also talked a little bit already about the need for schools to collect student health insurance information. But the only way that schools get paid for these services is by submitting a claim to the health plan that is obligated to pay the claim. And that's based on the health plan that the student receives their coverage from. So that information is critical for the schools to be able to access these very important resources. There's also, we also want parents and caregivers to know that student data and information, including the health insurance information, are confidential and secure, and that school districts and health plans must follow very strict privacy and confidentiality rules in state and federal law to protect student records, to protect student health insurance information, and parents and caregivers may be asked to sign a consent form so that the school can share data with the health plan and the state. Next. Just before we stop talking about the Children and Youth Behavioral Health Initiative, I wanted to share a little bit about some of the other resources that we have available through the Children and Youth Behavioral Health Initiative. And that includes the Positive Parenting and Thriving Kids video series that we released in March of last year. In this video series, which is available at the Child Mind Institute, and then Isabel just put the resource in the chat. There are 20 different videos, 20 videos in English, 20 videos in Spanish, that provide a bunch of resources to parents and caregivers, including information about evidence-based strategies, skills that they might want to develop or utilize when working with their children around common parenting challenges. So for example, the videos address self-care strategies for parents and caregivers, which is really important that we, as parents, take care of ourselves. I know I'm a parent of a child with a mental health condition, and it can be really stressful for parents to have to navigate and figure out, how to manage their child's issues or big feelings related to their mental health condition. And sometimes just taking a break to breathe or meditate or go for a walk and take care of ourselves is the best thing that we can do for our kids. So some of the videos talk about self-care strategies. There's also videos about parent-child relationships and communication strategies. There's videos about healthy child and adolescent growth, big changes that happen for kids as they develop and grow, and challenges related to that, as well as family and community stress. So all of these videos are free. They're all available online, and these are great resources to share with your communities as well. Next. And then we also wanted to make sure that you are aware of other free programs that we launched as part of the Children and Youth Behavioral Health Initiative that offer free digital support through either an app or through a web-based interface. And these are completely free programs. Bright Life Kids is a program that offers support to parents and caregivers and younger children ages 0 to 12. They provide free behavioral health coaching. What that means is that parents and their kids can work together with a behavioral health coach on strategies for addressing all kinds of different topics, like some of the things that we just talked about related to the videos. They can talk about parent-child relationships. They can talk about strategies for better sleep hygiene. They can talk about emotional regulation strategies. They can talk about tantrums and behavioral issues. They will even help new parents who have infants with how to kind of cope with being a new parent. So these are free resources that are available through Bright Life Kids. And then Saluna offers the same kind of services for teens and young adults. So this 13 to 25-year-olds, one-on-one coaching on demand with a live, qualified, very well-trained coach that can help teens and young adults navigate all the challenges that we all face in life, and that particularly our teens and young adults face as they are kind of naturally going through life as a teenager or naturally going through life as a young adult. So all those stressors that probably we all remember experiencing in those years, we have coaches that can help young people kind of navigate all of those challenges that we all face. Both of these programs offer coaching services in English and Spanish through the app or web interface. We also offer free telephone coaching in 19 other Medi-Cal threshold languages, and there's phone numbers that are on the website for each of these programs, where youth or their parents can call to get access to a coach over the phone using an interpreter service. And again, these are completely free services that are available to all Californians, regardless of insurance status, regardless of immigration status. They're available today. And so far, we've had over 130,000 people sign up for these programs. And there's 13 million kids between the ages of 0 and 25 in the state. So we have a long way to go, and we appreciate the support and getting the word out about these resources in the community. But of the 130,000 people that have used these programs so far, we've heard overwhelmingly positive feedback about how helpful these resources can be when, we're facing moments of stress and we just need somebody who's a trained professional to talk to about it. And these are available today. I also oversee our Justice Involved Reentry initiative. So as we just heard, there is some intersection between these two initiatives, and so my team is called the Office of Strategic Partnerships, because what we do at DHCS is really think about how we're delivering healthcare services with more non-traditional partners like schools, like correctional facilities, and making sure that services are more accessible where people need them. And one of those spaces is in correctional facilities, including state prisons, county jails, and youth correctional facilities. Under a new federal rule, states can apply for a waiver of a long-standing exclusion called the Medicaid Inmate Exclusion Rule, which previously prohibited the use of Medicaid funding while an individual was incarcerated for a period of time. And so what these waiver programs allow us to do is provide pre-release services to an individual while in custody for the 90 days prior to their release and reentry back into the community. And this is really important to be able to establish a care provider in the community that will support the individual's transition, provide continuity of coverage and care, increase service uptake, and making sure that those connections are being made between the individual while they're still in custody and their post-release care teams. It'll also provide treatment and stabilization services for a wide array of physical health conditions, as well as, importantly, linkages to behavioral health interventions for both mental health and substance use disorder services. So our goal is really to make sure that people with certain health conditions that are Medi-Cal eligible or Medi-Cal enrolled are able to get access to those treatment and stabilization services. They can get the care that they need while they're still in custody. They can get access to care management services through our enhanced care management program that is really coordinated to help make sure that there's that continuity of care both in the pre-release and post-release settings. And so it's really about kind of making those connections and the warm handoffs between the pre and post-release care managers so that the individual knows who is there to support them in the community once they go home. And part of our goal here is to increase access to care, but it's also to make sure that we are reducing morbidity and mortality for individuals who are re-entering the community. We know that for individuals who are or who have formerly been incarcerated, there are much higher incidences and a disproportionate impact in terms of behavioral health conditions, including opioid use disorder, and the mortality rates for individuals leaving incarceration within the 2 weeks post-release, for people who may have an overdose related death is significantly higher than in the general population. And so we want to make sure that we're getting people the help that they need while they're still in custody with that coordinated support to help the transition back into the community. We also want to make sure that we're reducing, emergency department visits and inpatient hospitalizations and all sorts of higher acuity services that might be the only path forward in the status quo. But now with this program, we can make sure that people are getting connected to a primary care provider or to a specialist for a physical health condition, and to the county behavioral health agencies for mental health and substance use disorder treatment services. Next. So the Reentry initiative is actually multiple different components, and the 90 days of services as part of the pre-release 1115 waiver is just one of these overall components. It really starts with the correctional facilities working with Medi-Cal eligible individuals to get enrolled in the Medi-Cal program. So in January of 2023, we launched the Medi-Cal pre-release application process, which requires county correctional facilities to work closely with county social services departments to enroll eligible members into the Medi-Cal program while they are still in custody. This includes even for jails, where a majority of people who are incarcerated in county jails are released within a week of their of being incarcerated, and a large number of those are released within 48 hours. At a minimum, a correctional facility can check eligibility and start the process for a Medi-Cal application so that the member is getting enrolled into the Medi-Cal program and can access supports in the community through their Medi-Cal managed care plan. As I said before, it also includes the waiver that allows us to provide the 90 days of services for pre-release, which requires the correctional facilities to make a link to the county behavioral health agency or the managed care plan when the member has a mental health or substance use disorder condition. And it also, we also are requiring the managed care plans to offer up to 12 months of enhanced care management services for all individuals who meet the 90-day pre-release services requirements. And so that intensive care management support through our ECM benefit is available to individuals upon reentry into the community for an entire year to really help support them. And then at that time, they may still need additional ECM supports, and the managed care plans will continue to assess their need. But there's automatically a presumptive eligibility in place for individuals who have been incarcerated to get access to ECM services in the community. This also includes community support, so housing navigation supports, for example, or home modifications, or respite care, or all of the different 14 community supports that are offered optionally by our Medi-Cal managed care plans. And I'm sure you've heard about our community supports program before, but we can also share additional information in the chat about community supports if you want to learn more. And then kind of really tying this puzzle all together. And one of the more important components of the initiative at large is ensuring that our managed care plans and our correctional facilities are working closely with justice involved reentry and transition providers. It's really important to enable the success of individuals as they are reintegrating back into the community, that our managed care plans are working with ECM providers that are experienced with this population, that have a long history of being credible messengers in their community. And so the network of reentry providers across the state are critical to the overall success. And that includes community health workers, many of whom work in these reentry organizations, have lived experience or lived expertise of incarceration and can really help people navigate that reentry period. Next. So in order to get access to these pre-release services, individuals must be Medi-Cal eligible. And for adults, they also have to meet additional healthcare needs criteria, including having a mental illness or substance use disorder, a significant or chronic condition, an intellectual or developmental disability, traumatic brain injury, be HIV or be HIV positive or have AIDS, or be pregnant or postpartum. For children and youth, including former foster youth under the age of 26 incarcerated at an adult jail, there is no additional criteria. So if they're Medi-Cal or CHIP eligible, they're automatically eligible to receive pre-release services in any correctional facility setting, as long as they meet those age requirements. Next. And these are all of the types of services. So I talked a little bit about that care management support, but it includes also physical and behavioral health clinical consultation to provide those diagnostic, treatment, and stabilization services. It includes reimbursement for laboratory and radiology services, medications, including medications in hand upon release. The correctional facilities must supply a full supply or 30 days or what's clinically appropriate of medications that the individual can take with them when they leave the correctional facility setting. It includes the provision of medications for addiction treatment or MAT services, for opioid and alcohol use disorder services, services provided by community health workers with lived experience, and durable medical equipment in hand upon release. Next. One of the things that's really important to understand is what the ECM benefit for our justice involved population really is. So there are 7 core ECM services. This includes outreach and engagement, comprehensive assessment and care management planning, enhanced coordination of care. So really helping the member by making appointments with their primary care provider or pediatrician for younger members. It could include making appointments with specialists. It could, in this setting, include coordinating with probation or parole or other parties that are also have some responsibility for coordinating care. And it definitely includes coordinating with county behavioral health agencies when members have a mental health or substance use disorder condition, and so that they can have a coordinated care experience across all of the Medi-Cal delivery systems. It includes member and family supports, health promotion activities, comprehensive transitional care services, and coordination of and referral to community and social supports, including the community supports offered through the managed care plans as part of the Medi-Cal program. So it's really an intensive whole person care, all of the above approach to support individuals that are part of the population of focus. And for our justice involved population of focus, the ECM providers are also part of that warm handoff so that they are getting to know the individual while they're still in custody and can start to build those relationships so that they're better positioned to be able to serve individuals in the community settings as well. Next. We have lots of different folks that are partnering with DHCS to implement this program, including our county and state correctional facilities. CDCR, our California Department of Corrections Rehabilitation, is scheduled to go live this weekend on February 1st with their pre-release services program. We have 3 California counties that went live in October, 1 more that goes live tomorrow. And so, really, we couldn't do any of this work without cooperation of our county sheriffs, our county probation officers, county health and public health departments, and they're a critical part of the infrastructure for this program. This also includes our county behavioral health agencies who may be providing in-reach services during that pre-release period, and certainly providing the behavioral health links and follow-up services in the community. Our community-based providers, including community-based organizations that provide community health worker services and are part of the Reentry provider network. that can provide pre-release in-reach services for clinical consultation. Pharmacies, our managed care plans. There's a lot of folks that are part of this overall puzzle in delivery system infrastructure. Next. And I already just said this, but this is just a visual of which counties and are going live when. And as I said, CDCR for our state prisons will be going live this weekend. And then all California counties have to implement this initiative by October of 2026 to comply with state law, which requires their participation. And so on a quarterly basis, we are phasing in additional counties based on their submission of a readiness review application 6 months prior to the requested go live date. So we'll have additional counties that'll go live in April, and then July, October, January, and so on, until all California counties for both adult jails and youth correctional facilities are live with the initiative.